I grew up in New York City actually, Queens, New York. Went through the New York City public school system, went to New York University. Started off as a podiatrist, went to New York College of Podiatric Medicine. Was in practice already, decided I wanted to go to medical school. Practiced while I was in medical school for my first couple of years, kept the practice going, then I sold my practice. And I went to New York Medical College. Did an orthopedic residency after that. Actually, while I was in medical school, I didn't decide I wanted to go into orthopedics, probably till my junior or senior year, third or fourth year. And then from there, I guess foot and ankle was the normal direction to take. You know, it probably varies from program to program. Some programs, you probably see a lot of foot and ankle in the program. Others, you don't see as much foot and ankle, so it's important that you do the fellowship. I was practicing in Michigan, and about 10 years ago, our economy took a bit of a crash. I had 3 young kids. I wasn't from the area, so I had to make a decision. Do I stay there and wait for the economy to improve, or do I make a move? I loved Michigan, but unfortunately, my kids expected to eat every day. So Ortho Georgia, they had a foot and ankle doctor who was leaving, so they were looking for someone. I came down, I liked it. I brought my family down to spend a week or 2. They liked it. It was a very quick decision, quick move. I mean, this all happened within a couple of months. The weather has been an adjustment. I traded snow for ridiculous heat in July and August, but I haven't had to pick up a snow shovel in 9 years now. I don't even know if we own a snow shovel. I don't know if it made the move with us. The first thing is, just because you're seeing a surgeon doesn't mean the only thing he has to offer you is surgery. There are non-operative treatments for various things that we see as well. So sometimes in that initial visit, not only do you have to diagnose, but you also have to allay some fears that you're automatically going to cut. So in those initial visits, it's a lot of listening, probably more listening than there is actually me speaking. Diagnosis requires listening. It's not all looking at x-rays, and patient to patient it varies. Some patients are not interested in surgery. Some patients are not good surgical candidates, so you have to understand that. Other patients probably are better off directly going to surgery for various ailments, and you have to decide that on visits as well. So, I mean, a lot of it is just interpersonal relationships that you have with the patient, understanding the patient. And I think a lot of that improves over years of practicing. I think we provide excellent care. I think the fact that we've had to put up a new building because we don't have enough room to treat patients in this one building attests to the fact that we're probably the go-to orthopedic place in Central Georgia. As far as competition's good. I'm sure Alabama doesn't worry about, who other schools in the SEC are recruiting. Lately, most of my interests lie in just being with my family. My children, I have 3 children. One is a senior in high school, and 2 girls are in college. So I don't know how much longer they're going to be around the house. So most of my time is spent with them. All my kids graduated or will have graduated high school here in Macon. My 2 girls go to college here in Macon. My son is probably going to go to college here in Central Georgia as well. So we're definitely going to have roots here in Central Georgia forever now. But that's mainly what I do now. I try to be with my family as much as I can, because I don't know how long they're going to be around. They may be moving off shortly.